Hey everyone, my name's Caroline Newmiller, and this is your first lecture for nursing management, and it's called Time Management and Prioritization. Probably one of the most important lectures that you're going to have. So I love Florence Nightingale. She has many very smart and popular quotes, and this one says, "Knowing how you manage when you are there impacts how your work should be done when you are not there." So think about that just for a few minutes. All right, and let's talk about obstacles to time management, because there are many. So some of them include lack of clarity about purpose and expected outcomes, making managing time futile. Members of a team do not respect each other when they manipulate and gossip. Procrastination, like putting off charting, causes stress in incomplete tasks. Perfectionism is a common personality trait in nurses. Lack of prioritization disrupts reaching goals. Ineffective communication causes anxiety and safety issues. Lack of organization makes you a crisis manager. And fear of failure causes avoidance in making an effort. So what are some time traps? Trying to accomplish too much and not delegating what you can. Lack of self-discipline and not setting deadlines to manage your time. Personal disorganization like indecision, procrastination, insecurity, confusion of priorities. Too much talk interferes with accomplishing tasks. And some examples of those time traps include you can't pass medications yet because you haven't looked them up. You need to round with the physician but you don't have the recent lab values, and you don't have all the equipment when starting a task like IVs and Foleys. So how can we help so that you do not fall into those time traps? Let's talk about the ABCs of prioritizing paperwork. Excuse me. This is like dividing piles into crucial versus not crucial. Typically, not crucial items tend to be more pleasant than crucial. When we don't prioritize, we tend to complete the not crucial items first, substituting quantity for quality. And we do that because they are more pleasant to do. So consider your consequences. If there are no negative outcomes in not doing the task, then don't do it. If there is a negative outcome to not doing the task, then you need to get started. So your pile A must focus most of your energy on the A pile. Train yourself to do the hardest tasks first. Pile B, contribute towards your goals and are high payoff, but they're not urgent and they can be delayed. They become A items as their deadlines approach. The C pile, do not substantially contribute towards your goals and have no deadlines, so you just do them as time permits. And your D pile are nice to do, but not necessarily. Reward yourself if you accomplish the items on your A pile. So there's this thing known as Pareto's 80-20 rule. 20% of your efforts produce 80% of your results. So spending 20% of your time studying the hardest content can produce 80% success in your exams. So keep that in mind. What are some strategies for effective time management? Use your brain sheet. Keeps you organized. What needs to be done on your ABC list? Establish a goal. Anticipate what might happen during the shift, because something will always happen. Use your resources wisely and delegate when you can. Use breaks and lunches. They create positive attitudes. Learn to say no when it's appropriate. If there is no significant benefit, decline it gracefully. End the workday on time. Have your charting done and things like that. And then meetings need to be organized and efficient. Otherwise, they are time traps. So let's talk about that Pareto's 80-20 rule again. It's the same rule that we just discussed. You're going to find that 20% of your patients will require 80% of your time. which is okay as long as those 20% are the sickest patients. When their cares and needs are met first, then the rest of your assignment will be easier. It's important to note that patients require the most time. Do they require that time that can be delegated? And do they require the most time because they are the sickest? Always think about those things. If they are not the sickest, they should not be requiring the most time. So how do you prioritize your clinical day? Prioritizing is defined as which needs or problems require immediate action and which ones can be delayed until a later time because they are not urgent. Evaluate and weigh each task or process using the following criteria. Is it life-threatening or potentially life-threatening if the task is not done? Would another patient be endangered if this task is done now or left for later? Is this task or process essential to patient or staff safety? And is this task or process essential to the medical or nursing plan of care? In every case, you must understand the overall patient goals. The context and setting is essential. 4th semester nursing student emphasis is prioritization. First priority is an immediate threat to survival or safety, such as a code or an obstructed airway or a patient fall. Second priority relates to actual problems where your patient or family asks for help, like pain, bowel, or bladder needs. Know your ABCs. It's just like your ABC in documentation, those ABC piles. A is the highest priority. These patients have problems or potential problems related to airway, breathing difficulties, and circulation. B are those scheduled medications, upcoming tests, teaching for scheduled discharge, and wound care. They become A items as their timelines approach. C are those teaching to prepare for a later discharge or doing family updates, things that need to be done but can wait for quite a while. And then D pile are things that are nice to do but they are not necessary. So think about what's critical or potentially life-threatening. Respiratory distress and chest pain, right? Then think about urgent things like safety needs and pain control, like a low blood sugar, patient needs pain medicines. Then routine responsibilities like assessments, vital signs, and scheduled medications. And finally extras like patient requests, need ice chips and warm blankets, things like that. So that does conclude our presentation for prioritization. I put this in here so that you would remember to go and look at the video on the pickle jar theory. It is very helpful to see that visual in understanding prioritization.